Welcome to Week 3, Chapter 3, the Case Management Work Format and Process. Case findings and targeting encompasses the determination of eligibility and the identification of high-risk and high-cost clients. Potential cases appropriate for case management intervention might be flagged by dollar caps or codes indicating a certain type of illness or condition, or by admissions. The way in which a case management approaches a new case is influenced by the referral source, generally the payer, and the lines of insurance. The accuracy of the entire case management process depends on the information gathered. Case managers should conduct an assessment as a reporter first and then as an analyzer of the information. Too many nurses and other case management professionals write wonderful documentaries about patients but do not tell and sell the role of case management. Because of this, too many client companies and organizations see case managers as observers of care rather than contributors to the care plan. Not every client wants the same type of initial assessment, nor does every client have the same document in mind when an initial assessment is requested. One company might consider an initial evaluation an on-site personal contact with the claimant, or an on-site personal contact with the employer, and an on-site personal contact with the treating physician, a 3-point on-site contact. Another company's initial evaluation might be either an extensive phone call or an on-site contact visit with the claimant only. Prior to beginning an assessment, eligibility for coverage under the specific lines of insurance paying for case management should definitely be defined. The case manager needs to discover the client's responsibility on this case for the individual under this policy. Often, eligibility has not been ascertained, so the case manager must ask the following questions. What is the line of insurance? Is this individual covered under this policy? And is there stop-loss coverage? The next question is, what dollars are available to this individual within the policy? In addition to the dollar amount, a case manager must ask about the limits and restrictions on types of care, care facilities, and length of stay. The data the case manager requests from referral sources will vary slightly depending on the line of insurance. Workers' compensation will include time and grade, salary replacement, union membership, lost earnings, return to work issues, and past medical plan cases. Following the initial conversation with referral source, the first person the case manager will interview is the patient. The objective is to obtain an overview of the patient's current medical history, the particular individual, the situation, the patient's understanding of his or her condition and prognosis, as well as the patient's ability to be participatory. Because past medical history may impact the present, the case manager must also ask leading questions about medical conditions that might, from a medical management perspective, affect a recovery. Another important query centers on medications. This area is crucial, and too little attention is paid to it by all members of the medical delivery system, including case management. There is a gap between what a patient perceives as a problem, what the medical profession knows is a problem. And again, one of the highest overlooked areas during the initial assessment by case managers is the medication regime. The case manager's assessment also centers on socioeconomic, psychosocial, vocational factors, as well as interests and hobbies. Before closing the personal meeting with the patient, the case manager should obtain a single medical authorization release form from the patient or the patient's guardian. A consent form is required to review medical records and to share information with the patient's physicians and attorney if the case is in litigation, and allows the case manager access to medical data regarding the patient. The case manager should interview the family for their perception of the situation, to explain the role of the case management, to observe the personal dynamics, to assess the prime caretaker's ability to fulfill that role, and to assess the family dynamics. To set the stage for a good working relationship with the treating physician, The case manager should explain the role of case management and communicate a desire to work with the physician to ensure the best outcome for the patient. It is also important to ask the following questions. What is the diagnosis? What is the treatment plan and prognosis? What do you think is going to be the outcome for this individual, both short-term and long-term? Do you anticipate any complications? And is there anything you feel you might need assistance with? Patient information, lifestyle change, or diet modifications? To get the most out of a telephonic case management, I encourage my case managers to get behind the no. If they ask the patient if she experiences any difficulty testing her blood sugar and she says no, I would usually then ask her to give them her reading for the last 2 days. If she cannot provide this, or if the response is inappropriate, there's a good chance she is having difficulty or is no longer testing her blood sugar. In some cases, an independent medical exam or second opinion is requested. A case manager's involvement is linked to the type of exam performed. An independent medical exam is generally utilized by insurance carriers to determine the diagnosis, the need for continued treatment, the degree of disability and duration of disability, and the patient's ability to return to work. In addition to the treating physician, the case management may need to contact facility staff nurses, attorneys, therapists, and other healthcare professionals. In some cases, particularly when workers' compensation, disability, or liability claims are an issue, an attorney will be contacted. Case managers working a group medical case rarely see an attorney involved in the case before getting in touch with the patients. With legal precedent for potentially holding case managers accountable, even though they are not hands-on care providers, it behooves every case manager to become familiar with applicable practice guidelines. Among many are the Agency for Healthcare Research and Quality, which publishes national clinical practice guidelines for more than 2,531 clinical subjects. The Case Management Society of America has published its standards of practice, and Aetna Health Plans and the ICMA developed case management practice guidelines. Case managers should document both their adherence to and reasons for deviation from guidelines. The key points regarding use of guidelines is to apply them wisely, fully document choices and actions, and clearly communicate reasoning to the appropriate parties. At times, a case manager has responsibility for making recommendations for services and putting services in place. She owes it to herself or himself, the patient, and the client's company that referred the case to make sure that what has been put in place is working, remains quality in nature, is cost effective, and is necessary. Obtaining approval for monitoring from a client company can be difficult. Managing a case without monitoring, it can lead to liability exposure. The monitoring process varies from case to case. Along with monitoring the medical treatment plan and its effectiveness, a case manager evaluates and reevaluates his or her own case management plan over the course of an intervention. Is the treatment working? Is the patient cooperating? Quality of life is less easily measured than the quality of money spent on care. What can the case manager use as a yardstick to measure care process? As long as improvements are going, the treatment course can be justified.